teacher, the principals themselves, and also on the school and the community. In a school, you never ever do something without thinking what parents gonna think. So if we're still thinking that working with school during a pandemic is only limited to producing guidelines, we miss most of the key levers of success at the school level. Third idea now, how could we move forward? What's the next step? The first thing we have to have in mind is that from a country to another, schools are very different. And also within a school system, this school with a capital S does not exist. There's different schools and different contexts. And we really need to understand what happens in this particular school and what mechanisms led a school to promote the health of the adolescents. So that's why we need not only to understand what to implement, but to understand also what people do with the guidelines, with the knowledge about health, and then to understand what happens between the international guidelines and the national guidelines, and between the national guidelines and the school, the communities. So it means that we really need to understand the views of practices of the professionals. My fourth idea is just to give you some ideas about the work we did with Nicolas Gray in the survey launched by the UNESCO chair. In order to understand what happens in the field and what are the mechanisms that led a school to be able to enact a health policy that is positive for adolescents' health, we launched a global survey in different countries in May 2020. We now in the second phase, and you're going to have the results of the second phase in the following month. We had the feedback from 42 countries on the planet. And what did we learn? What did we learn from the way in which schools are, developing policies at the local level in relationship to the pandemic? To understand that, we asked 3 groups of questions. One about the way in which the school coped with the lockdown and the reopening process. The second was what people in the schools think of the guidance they have from their state or from their territory. And third, what are the concrete, the operational enablers, obstacles, and solutions for school reopening? And the results were extremely interesting. First of all, we have to know, and you know that, but teachers and principals are just people. So they also feel the same kind of feelings people feel in such a context. It means a question of fear, a lot of questions about the way in which we organize the fight against the virus. And they are also affected, like the students and like all of us, by mental health problems. And this is important to have in mind in a strategy of implementation of measures. The second thing, which is extremely important in terms of relationship between health and education in this context, is the question of inequalities. This is always the first thing teachers, principals say about the pandemic. What are we gonna do with kids having no means for online teaching, with kids who are far from the schools, with kids and students and adolescents who are in trouble? The fourth idea we learn is that it's not so evident for education professionals to understand and implement the national guidance for a reason. And it is evident in most of the 20 countries